Thank you for joining us. My name is Grace, and in this video today we're going to talk about COVID-19, also known as coronavirus. Today we have the New South Wales Chief Paediatrician, Dr. Matt, to answer questions children and young people have about coronavirus. Thank you for being here, Matt. What is COVID-19?
COVID-19 is the name of a viral infection caused by a new strain of coronavirus. Coronaviruses have been with us for years. They commonly cause colds and coughs, but sometimes they can cause more severe infections in people. There have been two coronaviruses you may have heard of before. SARS, which emerged nearly 20 years ago, and MERS, which came about a decade ago. Coronaviruses sometimes cause illnesses in animals as well, and we think this strain of coronavirus may have started in an animal, like SARS and MERS did. So COVID-19, that's the name of the illness caused by this new strain of coronavirus.
How do people get it and how can I help?
Coronavirus spreads really easily. You can get it from when you touch someone, and touching can be simple as a hug and a kiss, or playing sport. You can get it when someone around you coughs or sneezes and makes little droplets in the air, and those droplets then land on your face, in your nose, in your mouth, and your eyes. You can get it when someone who's spreading it touches something and leaves some virus on it, and then someone else touches it and then puts it on their face, in their hands, and so they get it. It can also spread when someone touches an object and leaves some virus on it, and then someone else touches that thing and then puts it on their face, in their mouth, and rubs their eyes. And this virus can stay alive on surfaces like plastic and stainless steel for even as long as a few days. Viruses can even spread from someone who's got it before they even know they're unwell. So probably in the day before they start becoming unwell, they're spreading the virus. And that's why we're so concerned about keeping people separate from each other.
How do we know if we've got it?
If you have COVID, you may have a fever, a sore throat, a cough, or finding it a bit hard to breathe. There's lots of other reasons for having these symptoms, lots of other more minor viral infections. These are the things you should look for, and if you have them, you should call your GP or call Health Direct. And if you feel really unwell, like you're finding it really hard to breathe, you should go to emergency or call an ambulance.
How can people protect themselves from getting it? Should you wear a mask? Do you need hand sanitiser?
The best ways to protect yourself are by coming in contact with as few people as possible. That's why we're doing the social distancing. You also need to get really good at washing your hands with soap and water or with hand sanitiser. If you're unwell, stay at home. Don't go near people who are coughing or sneezing. If you need to cough or sneeze, even when you're at home, cough into your elbow, sneeze into tissue, put it in the bin, then wash your hands. You don't need to wear a mask. Masks are for people who have the virus to help stop them spreading it to other people. Masks are not recommended for people who are well.
What exactly does social distancing mean?
It's about keeping a space between you and other people so you don't touch, even accidentally. About 2 arms length is the right distance. It makes it much harder for the germs to travel from one person to another. And that really means a very different way of saying hello and goodbye to people. No handshakes, no hugs, no kisses, no high fives. I know that's really hard for some people because that's the way we express our joy in seeing them. But these are special times and we need to learn how to behave differently.
So I play netball. How do I play sport and also practice social distancing?
There's some sports that we think of as contact sports and they're clearly not on. But most sports require us to be pretty close to other teammates, even for non-contact sports like netball. So for the moment, while this virus is spreading, we need to be really careful. So all sports off.
How do we know what's safe and what's not safe?
There's lots of good advice around, but because the situation keeps changing and we keep learning more about this illness, the advice keeps changing. And it needs to keep you safe, but also all the people around you, your friends, your family safe. And when you look for information, go to a reliable source like New South Wales Health or Health Direct.
What should I do when I feel it's overwhelming?
You can easily get loaded up with too much information from news and social media, and not all of it is true. Have a break from it sometimes. Do things that make you feel calm. Talk to someone who you can trust. There are organisations that can help you deal with these stressful times, to give you strategies, to offer counselling. Places like Headspace and others are good at this.
What do I do if someone in my family gets it?
So if someone in your family's sick, you may need to help look after them, but be really careful about hand washing and try to keep them as separate as possible. You'll need to check to make sure they're well enough. Sometimes they might need to go to hospital. Look after yourself. Because you've been living with someone who has COVID, you'll need to be in quarantine. Look after yourself. Keep yourself safe. Monitor your symptoms. Contact a health professional if you start to feel unwell.
What does quarantine and isolation mean?
Quarantine means staying well away from other people because you're at higher risk of developing COVID. And that's because you've been travelling overseas or you've been in touch with someone who's got the illness. It means you can't go out, you can't go to the shops, you can't have visitors. But you can mix with people you live with. Isolation means staying completely separate from other people in your house because you have the infection.
How long will all of this go on for?
We're not sure, but it's likely to go on for a few months. Things can get back to normal when it's safe. That's either when the virus dies out or when we've got protection from a vaccine. It's hard to imagine such a big change in the way we live going on for so long. But that's the best way to control this illness, and it's what we need to do.
Will things ever get back to normal?
We don't know exactly when that will happen, but we're doing our best to make it happen quickly. You will be able to go back to work, to school, to university. You'll be able to go and visit friends, be able to go to the beach, be able to play sport again. It's just going to take some time, and the sooner we get on top of this, the sooner life can get back to normal.
How did it get to Australia?
Viruses mainly travel with people, and so because people travel the world so much, for work, for adventure, the virus travelled with them. And because this one spreads really easily and can live on surfaces for a while, that's why it's spreading so quickly.
Some people are saying this is all not true. Is this a conspiracy?
We have outbreaks of viruses from time to time. They've happened over the years and the centuries. This is just another one of them. We can see from news reports around the world that this is a really serious problem, and we need to do whatever we can to stop it spreading.
Remember, it's a really good time to look after your health by washing your hands and staying away from big crowds. It is normal to feel anxious or upset about COVID-19. If you have been affected by the contents of this video, please reach out and call one of the numbers on the screen.